Hi, this is Dr. Kayla Cook and I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're talking about SI joint pain and dysfunction. Everything about it, what's the diagnosis of it, how do you get it, what are symptoms of it, and then what's the best way to treat it. Kayla is actually an expert on SI joint dysfunction and she has advanced training in this, so we're going to create this video today to kind of give you some education on, how do you know if you have an SI joint problem and what's the best way to do about it. So first off, let's start off, what is an SI joint dysfunction, or what is an SI joint problem?
So SI joint, that is where your pelvis is meeting the bottom of your sacrum. And so that's where we usually get our pain levels. It can go from low back pain, but it's usually more pinpoint as to the lower butt or just more one-sided pain.
Okay, so again, it's not a low back problem, even though a lot of times people will come in here complaining of lower back pain. Sometimes it's actually an SI joint problem. So when patients come here, there's always a differential diagnosis. Is it a low back herniated disc problem? Is it a low back compression problem? Or is it an SI joint sacral problem? Those are actually different problems, but sometimes patients come in with just lower back pain. So that's a generic garbage diagnosis. We really want to get at what type of low back pain do you have? And it could be an SI joint problem. What are some of the symptoms of an SI joint pain? How would someone know if they have an SI joint problem or not?
So typically symptoms are seen one-sided versus both. They also have a lot of pain with sitting for a long time, standing for a long time, taking the stairs, or going from a sitting to a standing position.
Yeah, and then I would probably even add into, it's very common in women postpartum, after like labor delivery or after a huge fall. We can get into there's different types of SI joint pain versus dysfunction, but that's us nerds talking about really dorky stuff. So we don't have to get into that today, but you'll never have pain shooting below the knee. Yes, it is more unilateral. Just to mention, I actually had a case recently where I had this 72-year-old male who had multiple fusions in his back, and he was having pain over his SI joint. And they didn't solve the root cause, and they actually fused his SI joint. There's people out there who actually get fusions done, and his pain was still there because it was actually coming from his lumbar spine, not his SI joint. So even though we're making this video sound like pretty easy and cookie cutter, really SI joint pathology is a lot more complex than what it is. And a lot of time pain refers down to the SI joint or refers down the leg, gets misdiagnosed as sciatica. So it is more complex than just cookie cutter black and white SI joint problems, but that's a perfect example there of solving the root cause of your SI joint pathology before going in and getting surgery. So we talked about diagnosis, we talked about signs and symptoms. Let's go over treatment. So what's the best way to treat an SI joint problem?
Well, first, it's to make sure it is coming from your SI joint. We want to make sure that is, your cause and what to do from it. From there, we're going to do very mechanical-based treatments. We're going to see where your dysfunction lies and how your spine and your pelvis are sitting. Based off of that, we can do manual techniques to help correct. We're not going to actually correct the way that your pelvis sits because there's nothing wrong with how your pelvis sits, but we're working on the muscles surrounding, we're working on how the joints are closing in on themselves. So we do a lot of manual-based work, also working with your physician and pain management for the meantime of getting those pain levels lowered. And there's other treatments that we can do in the clinic that are specific to physical therapy.
Yeah, we also see there's a lot of hip problems with an SI joint problem. And from my experience also, I'm not sure if you see this, that there's always something that pulls you out. I hate using that term out of alignment because the SI joint is really strong and thick and there's not really movement. But sometimes it helps the patient to kind of understand what is going on and why we're trying to treat this asymmetry. But a lot of times there's a hip problem that keeps pulling it out of alignment or causing torque across it and stuff like that. So we've gone over diagnosis, what signs and symptoms that you should know if you have an SI joint problem, what are some common risk factors, and then we also went over some treatment. So if you think you're struggling with an SI joint problem or you're trying treatment and it's not working, you can give us a call. You can click on the link below. You can give us a call at 407-494-8835 or visit the website for more information at pursuittherapy.com. Thank you for tuning in. Hope you learned a little bit about SI joint, and hopefully we see you soon.